The clavicle, also known as the collarbone, is a long, slender bone that connects the shoulder blade to the sternum, breastbone, in the middle of the chest. Fractures of the clavicle are relatively common injuries, especially among athletes and people involved in high-impact sports or activities. Causes: clavicle fractures can occur due to a variety of causes, including direct blow or trauma to the shoulder or collarbone area, falling onto an outstretched arm or shoulder, car accidents or other high-impact collisions. The symptoms of a clavicle fracture can vary depending on the severity of the injury, but common signs and symptoms include pain and tenderness in the collarbone area, swelling and bruising around the shoulder and collarbone, limited range of motion in the affected arm or shoulder, a visible bump or deformity in the collarbone area, difficulty breathing if the fractured bone presses against the lung. Most clavicle fractures can be treated without surgery, especially if the fracture is not displaced. Non-surgical treatment options may include immobilization. The affected arm and shoulder may be immobilized with a sling or brace to help promote healing and prevent further injury. Pain management: over-the-counter pain relievers, such as acetaminophen or ibuprofen, may help manage pain and discomfort. Physical therapy: once the fracture has started to heal, physical therapy exercises may help restore strength and range of motion in the affected arm and shoulder. Surgery may be necessary in some cases, particularly if the fracture is severe or the bone is displaced. During surgery, the bone may be realigned and held in place with plates, screws, or other hardware to facilitate healing. Types of fractures of clavicle: there are three main types of fractures of the clavicle. Midshaft fractures: these are the most common type of clavicle fracture and occur in the middle part of the bone. They can be caused by a direct blow to the shoulder or a fall onto an outstretched arm. Proximal fractures: these occur near the shoulder joint where the clavicle connects to the shoulder blade. They can be caused by a fall onto the side of the shoulder or a direct blow to the area. Distal fractures: these occur near the sternum where the clavicle connects to the chest. They can be caused by a direct blow to the area or a fall onto the front of the chest. Depending on the severity of the fracture, it may be classified as a simple or compound fracture. Simple fractures are when the bone breaks but does not break through the skin, while compound fractures are when the bone breaks through the skin. Additionally, fractures can be displaced or non-displaced, depending on whether the bone has shifted out of position or remains in its normal alignment.